Good morning, good afternoon, or good evening, depending on where you are in the world. I'm Amanda Pedersen, news editor at MD+DI, and this is Medtech Unfiltered. Today, we are talking about the Department of Health and Human Services' recent announcement that FDA will not require a pre-market review of laboratory-developed tests without first going through a public notification and comment period. Now, this is not a new issue by any stretch of the imagination. The issue of regulating lab-developed tests has been kind of a hot-button topic in the industry for years, actually. And it's something that CLIA labs in particular have lobbied for reduced regulation from FDA. In the past, FDA has been accused of, when they started regulating CLIA lab-developed tests, the agency was accused of making a power grab. It was seen as kind of a power move and unnecessary regulation and extra red tape when these are already laboratories that have gone through the CLIA process. So it's not a new issue by any means. But still, in the context of COVID-19, this issue, as I see it, is a double-edged sword with freshly sharpened blades on both ends, really. And I received an interesting email yesterday from an industry thought leader, and while they did ask to remain anonymous on this particular issue, I can assure you that this is not just some internet Karen or Kevin or Joe Schmo or whatever name you want to give them. This is someone who is has deep knowledge of matters of industry regulation and someone who's worked with lab-developed tests for years. Definitely someone who is a knowledgeable source. But what was interesting about what really caught my interest, what stuck out, is the email posed an interesting question. Why is this a Trump issue? Because in the preview, when I previewed the topic for today's discussion, I had posted as, and you probably saw it on your screen when you got the notification that we're live, is Let's Talk Trump and FDA. Admittedly, I had to think about it for a minute. Why did I frame it as a Trump issue? Well, in many ways, the Trump administration has made this a political issue by taking advantage of a pandemic to slip something through that essentially limits oversight on certain COVID-19 tests. Now, just to be clear, this does not apply to the majority of COVID-19 tests that are on the market. This is just the tests that are used solely within the laboratory in which that they were created. So these aren't just any Joe Schmo that's developing a test and getting it pushed through. These are CLIA labs. So there is a very strong argument in favor of this decision. Of course, less red tape means that lab-developed tests will reach the front lines faster, which is, of course, a good thing at a time when we are desperate for increased testing, especially in the United States. At the same time, though, I'm not sure that the middle of a pandemic is really the best time to be reducing regulation of testing, especially when it's become so abundantly clear that not all COVID-19 tests are created equally. And in a lot of ways, I would argue that false negative results are more dangerous than no results at all. So yes, we do need more testing, and perhaps reducing regulation is one route to doing that. We have to keep in mind that, when you get if you get a false positive test, if you take a COVID test and your results come back positive, Well, first of all, that's not something that's happening. It's more common to get a false negative than a false positive. But for argument's sake, let's say you get a false positive. The worst thing that happens is you spend 14 days in quarantine, and that sucks, but life goes on. At least you took the necessary precautions and you kept your loved ones safe by not leaving the house and trying to limit exposure and whatnot. But if you get a false negative result, it's like a false sense of security. It's like saying, "Hey, you're fine. You just got tested. You're negative. Go ahead and go to Walmart or whatever." But so I just really think that there is a real serious issue with false negative results with some of these tests. The other problem with this regulation coming at this particular time is that it leaves FDA in the dark. Right now, FDA has really been pretty transparent. I get multiple emails every single day, and then usually at the end of the week, at least once a week, kind of a wrap up of here's all the things that we've done, all the things that have happened, related to COVID-19 testing or COVID-19 therapies or whatnot. So they've been very transparent. They update the number of tests that they have issued an emergency use authorization for. They've been very transparent about those numbers, and they've been transparent about the ones that they've later said are not accurate enough and had to revoke the authorization for some of those tests. So by creating this loophole and going around FDA at this particular time, it just adds to the confusion. I mean, we're already getting so many mixed messages. We meaning the general public and the industry and everybody from top to bottom. The messages are mixed. You almost feel like you're getting whiplash. It's like, we need to do more testing. No, we're doing too much testing. We need to wear masks. No, we don't need to wear masks. It's just, this is just one more thing that is going to create complexity and confusion. And make it harder for FDA to be transparent. How is FDA going to know what tests are being developed, what tests are coming down the pipeline, and what tests are out there if it doesn't pass through their review, if it doesn't pass over their desks at one point or another. So. Then you got to ask yourself, because these are unprecedented times, and this is a pandemic, and to some extent you got to do what you've got to do. So you ask, what is the worst that could happen with reduced regulatory oversight of lab-developed tests? Well, for starters, you could end up building a multi-billion-dollar company around an overhyped test and eventually face fraud charges. So not to pick on Theranos, of course, but that would be like kicking a dead horse. But the best thing to come out of Theranos' very public demise is that it serves as a cautionary tale for the rest of the industry. So the issue of lab-developed test regulations brings up some other good questions for the industry. For example, if FDA's hands are tied when it comes to these tests, does that then place additional responsibility on the scientists and executives and everyone else who works at those laboratories? Do they have to? Does that extra burden fall on their shoulders to ensure the safety and accuracy? What is to stop these labs from pulling a Theranos? What is to stop these labs from making unsubstantiated claims And ultimately, what is the industry's responsibility in all of this? Or as my source put it, if everyone in the industry did their jobs, would we even need an FDA? So that's what I see is the real danger of this happening at this time, is the precedent that it creates for the industry. It's just if you start limiting FDA's power, if you want to use that word, or oversight, you start doing that with lab developed tests. What's to stop the government a few weeks from now from saying, you know what, FDA is no longer going to authorize any tests. Anybody that develops a test, any company that develops a test and wants to sell it to other labs, just go ahead. We put our faith in you, and do what you got to do in order to get these tests out to the public. That's a very slippery slope, it really is a complex issue, and I'm in a 10 to 15 minute broadcast, we couldn't possibly dig into all the complexities that this brings up. For example, for years, the biggest argument against FDA regulation of lab developed tests is that they've been treated much like a device. FDA sort of regulates lab developed tests in a pretty much similar way, same way as they would regulate a medical device, like an implant or what have you. So that's the big question, and that's probably one of the biggest arguments that the the diagnostics industry has put forth over the years for why FDA, why there needs to be changes. So this decision is an important one, and I'm not saying it's the wrong one. I'm saying that I don't think it's the right time to be making sweeping decisions like that. So anyway, that's just my take. As always, at MD+DI, we do strive to tell all sides of a story and to cover issues from all angles. So please do reach out to us if you would like to make your thoughts known on this or any other issue that we cover. Again, I'm always happy to take questions, and I'm happy to take constructive criticism as well. I love to hear all sides of an argument. If you agree or disagree, either way, I want to hear from you. So as always, I strongly encourage you to reach out. And again, if you're a little shy, too shy to use the comment section below, I invite you to email me. All I ask is that you do include Medtech Unfiltered in the subject line, because it is I do get quite a few emails, so just something to get my attention and know that it relates to our weekly broadcast here. But with that, that pretty much sums up everything that I have to say about the issue. I'm honestly a little surprised. I was hoping with this one, because there are so many different angles to it, and it is such a complex issue, and one that has been debated at length since at least 2014, if not longer. I thought that there might be some more comments or a little bit more questions or comments, engagement from you guys, but it's okay. There's no time limit on commenting. Even after we end the live broadcast, you can comment anytime on this or any other issue that we talk about here. But thank you for watching this episode of Medtech Unfiltered, and I'll see you next Tuesday.